This slide. Light. Oh, it was already on. Okay, sorry. Bonsoir. Le premier cas présumé de la COVID-19 a été détecté au Nouveau-Brunswick. Le test de diagnostic a été effectué au laboratoire de l'hôpital de Georges L. Dumont à Moncton, qui a confirmé que ce cas est présumé. D'autres tests seront menés au laboratoire national du microbiologie à Winnipeg pour confirmer que ce cas est bel et bien le COVID-19. Le cas est une femme entre 50 et 60 ans dans la zone 1, c'est le sud-est de la province. Un test de dépistage sur la patiente de France a été effectué. Il a été confirmé que la patiente a fait un voyage à l'étranger. La patiente a été traitée et testée. La personne est en isolement. Alors, ça veut dire qu'ils sont en isolation à la maison. The first presumptive case of COVID-19 has been detected in New Brunswick. Diagnostic testing was conducted at the Moncton's George Dumont Hospital laboratory, which confirmed the case as presumptive. Additional testing to confirm the case as a positive COVID-19 case is going to take place at the National Microbiology Laboratory in Winnipeg. And just to go through the process with respect to how this patient was identified, the ER was notified by phone ahead of time, and the ER was prepared and took full precautions to receive this patient. This patient was minimally symptomatic and has been home on self-isolation, and public health will be in daily contact with this person, and as well they will be doing the contact tracing associated with the situation. So this case is a woman between the ages of 50 and 60 years old in Zone 1, which is the southeastern part of the province. The patient traveled internationally from France and was confirmed that the patient has been treated and tested and is in isolation at home. Public health measures are already being put in place to prevent the spread of the virus by reaching out to all individuals who may have been in contact with this person, assessing their health, and instructing them to stay home for 14 days after their last contact with this person. And I will just want to also qualify this. I did a press conference earlier today, and I did want to really focus on the fact that in Canada right now we have over 90 cases, but almost all of them have been travel-related. So this is not unexpected. We expected to have a travel-related case here in New Brunswick or more. And with respect to transmission, the only two people that this was transmitted to in Canada so far were the very close contacts of two individuals. So when I say family members, household members, like the spouse of. So when we do close contact tracing, those are the people we're most concerned about, but we will be doing our contact tracing as in any situation like this. Les responsables de la santé publique communiqueront immédiatement avec toutes les personnes qui pourraient avoir été en contact avec cette personne pour évaluer leur santé et leur demander de rester à la maison pendant 14 jours suivant leur dernier contact avec cette personne. Toute personne qui a été en contact étroit avec cette personne et qui présente des symptômes subira des tests. We have been preparing for this situation since the first case appeared in Canada, so we have been meeting on a regular basis. We have ramped up all of our response efforts with Department of Health, Public Health, EMO, our partners across government, our partners in the communities at the regional level, et cetera, and as well as the RHAs. So this is something that we have been preparing for, that we are prepared for to respond to. At times like this, it helps for people to know that what they can do to protect themselves. And it may seem odd that regularly washing your hands and avoiding touching your face can protect you from a serious illness, but it does work. So regular hand washing, coughing or sneezing into your elbow sleeve, disposing of tissues properly, avoiding contact with sick people, and staying at home when you're sick are always important to prevent the spread of respiratory illness. If you are feeling sick, it's particularly important that you not visit loved ones in hospitals or long-term care facilities, as people in these locations are at the highest risk of complications from influenza and other respiratory viruses. So if you have any questions about these or any other health concerns, please call Telecare at 811. And our public health and health system are ready. We are able to detect these cases with our surveillance system currently, and our top priority is protecting the health and well-being of New Brunswickers.
Good evening, bonsoir. As Premier of the province, I am here to show my support for and confidence in Drs. Russell and Muick and the entire team at Public Health. We knew this day would come, and that is why we have been working diligently to prepare to respond appropriately in the case of the coronavirus in our province. Let me assure you, we are ready. Public health and emergency measures organizations, leaders have been preparing for this since the first virus emerged in January. Je peux vous assurer que nous sommes prêts. Les responsables de la santé publique et de l'organisation des mesures d'assurance se préparent à cette situation depuis le virus émergé en janvier. It's reassuring to know that the protocols and the processes that have been put in place work. We have and are executing our preparedness plans, and they have been proactively set in place to mitigate and respond to the potential spread of this disease. Our government officials will continue communicating, planning, and coordinating with first responders, our communities, and individual New Brunswickers to ensure the health and safety of all New Brunswickers continues to be the top priority. The confirmation of our first probable case of the coronavirus here in New Brunswick is more important than ever that we continue to work as a team. Our government is committed and prepared to do whatever it takes to support the public health and emergency measures organizational teams during this outbreak. Both organizations are working diligently to ensure New Brunswickers are responding and protecting the health of New Brunswickers against COVID-19 and minimize impacts and disruption. I thank all of them for their efforts. As the situation continues to evolve, updated information will be continuously provided through our website at gnb.ca/coronavirus, on the Government of New Brunswick social media channels, as well as through traditional media. Thank you.
Oui, non, je pensais que le ministre était pour parler. Madame, j'aimerais savoir, donc elle est dans le sud-est, on n'a pas plus de détails sur la ville ou le lieu où elle est, cette dame-là?
Alors, comme la Colombie-Britannique, quand il fait les annonces puis il donne des informations sur les cas, il détermine c'est comme quelle région dans la province que ça a été diagnostiqué. Alors, c'est ça, on donne la région dans la province, alors on dit c'est le sud-est.
Et elle est de retour de France,
oui.
Vous avez dit?
Oui.
Savez-vous de quelle région en France?
Non.
Et puis, son état, donc elle est à la maison, son état est stable?
Oui, oui.
Il n'y a pas de danger pour sa santé?
C'est ça.
Can you tell us how many people you have been talking to about like containment in and around this, around this individual?
So we only received the results late this afternoon. So in terms of the process starting from the time that the patient was informed, that is when everything starts to happen around the contact tracing, et cetera.
And they were informed today?
Yes.
And I guess, where do you go from here? Like, what are next steps?
So again, as in any communicable disease, the public health process in terms of contact tracing is in effect. Again, as soon as the patient is aware, then we do all the contact tracing, and so that's happening. For instance, just like in the measles outbreak. So right now, that is the process that we're undergoing.
When did she return from France?
I don't have that information.
Did this individual, was she traveling with anybody at this time?
I don't have that information.
Wouldn't that be one of the people that she may or may not have come into contact to if she was traveling with people?
So the patient just learned of their diagnosis very, very recently, and so the public health process in terms of contact tracing would just have begun.
How is she doing?
She's at home in home isolation, and my understanding is her symptoms are mild.
So again, explain what she did in order to be tested.
So my understanding is that she phoned ahead either to 811 or public health or the emergency department. She phoned ahead, so they knew to receive her with the proper precautions in place. So she wasn't sitting in an emergency room department or anything like that, waiting room rather. She was taken right in for assessment and put in an isolation room. Those were the steps that were taken, and then she would have been tested after that.
And how long did it take to get those results, I guess presumptive results from the Georges de Mont?
I'm not sure.
Have you alerted the authorities in France?
Again, we just learned of this information, and so all the processes that are coming to follow have just been implemented.
You said southwest New Brunswick, where?
Southeastern New Brunswick.
And where?
So as I said earlier, when British Columbia has been announcing their cases, they give a region, and so that's what we're doing. We're telling you what region this person is in.
Why do we have to follow the same rules as British Columbia?
Well, first of all, we're a much smaller province than British Columbia, so we do have privacy rules that we try to adhere to, or that we must adhere to, and so again, if you have a small population and you narrow down those parameters, then it gets harder and harder to protect privacy.
Just recap again, how many people was she been in close contact with? No.
The process just started. This patient has just been alerted to her diagnosis.
And she's just got mild symptoms, she's doing okay?
That's my understanding.
Kevin?
Elle doit rester chez elle combien de temps? Est-ce que c'est le 14 jours comme on parle pour tout le monde ou c'est plus long dans un cas comme celui-là?
J'ai pas tous les détails, sauf que d'habitude, c'est après qu'ils ont plus de symptômes puis ont eu 2 tests négatifs.
Et ça veut dire combien de temps?
Je sais pas, ça dépend combien longtemps qu'elle va avoir des symptômes. Alors, après qu'on aura plus de symptômes puis ils ont testé 2 fois pour déterminer que les tests sont négatifs, après ça, elle sera plus besoin de rester à la maison.
Je lisais une nouvelle tout à l'heure pour le Québec qui disait qu'on n'a pas besoin de faire les tests à Winnipeg. C'est quoi la situation exactement? Est-ce qu'il faut envoyer le test à Winnipeg encore?
Alors, chaque province a des différentes capacités pour faire des tests. Alors, pour commencer, la Colombie-Britannique et l'Ontario avaient leurs propres tests qu'ils pouvaient faire, puis ils n'avaient pas besoin vraiment de les envoyer au laboratoire national de microbiologie à Winnipeg. Mais au fur et à mesure que les choses les processus ont changé, nous, ici au Nouveau-Brunswick, on a eu la capacité de tester ici en province pour dire que c'est un cas présumé. Puis le test, on va l'envoyer les échantillons à NML quand même pour le confirmer, mais on a la confiance dans le test qu'on fait ici au Nouveau-Brunswick maintenant qu'on peut dire que c'est un cas vraiment probable.
Donc, quand vous dites présumé, juste pour que ça soit vraiment très clair, c'est comme on est à 90-99% sûr que c'est un cas.
Oui. Sinon, on ne ferait pas cette annonce.
Merci.
Combien de temps avant le retour du test qui est envoyé à Winnipeg?
Ça dépend combien de temps, quelle journée qu'ils ont renvoyé, puis la distance de voyage et aussi quand que le test est fait. Je ne peux pas dire.
Premier, you made a statement about how it's now more important than ever that you work as a team. This afternoon, the Brunswick Medical Society has put out a statement criticising your education, saying he shouldn't be setting policies, and in fact, Dr. Russell should be lead hand on this. Dr. Russell announces the nursing home policy different than the school's policy. Would you understand why New Brunswick is confused, and are you going to change this up so we're hearing from one person, or what's your thoughts there?
Well, I think it's very important to your point of having one voice in all of this, and so today, I think, and earlier today with Dr. Russell reporting on our protocol around nursing homes and around hospitals is the start of all that. I think that certainly the communication earlier from the doctor is somewhat disappointing because, and I suspect that if this information had been available at this point, you probably wouldn't have seen that tweet because it's. I don't think we can ever be too careful. We won't make any excuses for being out in front of this, and I guess this protocol worked well, which is very reassuring that the system worked, and now the person is under control and in their home or in isolation, and I think that by itself is very reassuring. We'll be monitoring all of these cases very closely, and the one voice is important, and that is certainly why I'm here with Dr. Russell and with the Minister, because that's certainly our path forward, and we've set up a team internally, not only that's managing the internal coordination, but also with the political parties, so we're setting up a team with the other leaders to be part of this too, so it's not what else can we do in the legislature as a general discussion, but basically they're going to be part of this going forward. And now the plan was that would be starting next week. I think we'll probably ramp that up to our first meeting will be either tomorrow or Friday.
So will we be hearing more policy decisions from Minister Carty on what goes on in Brunswick schools
Well,
regarding coronavirus or not?
the goal here and objective would be that we would all be hearing from it right here in this situation. I think that Minister Carty has an in-depth knowledge of world issues and certainly health issues around the world, because that's kind of where he came from. So I appreciate his intensity and I appreciate his genuine knowledge on all this. But let's leave it to the health authorities. Let's leave it to the medical professionals. I've always been more in favor of someone who's going out and going the extra mile than waiting to be pushed down the road. So with Dominic, there's not any real issue around going the extra mile.
Premier, are you going to the First Minister's meeting, or have you, I understand, perhaps asked to do it by teleconference?
Well, I haven't officially canceled my trip there yet, but we are in communication right now with the federal government and with my colleagues, basically suggesting that we should be doing this by teleconference. So, as you know, we've put out just very recently a travel ban here for G&B employees, and I think it's important, given the knowledge today, that I respect that ban as well, and that I'm here in the province, and I'm asking to set this up on a video conference, which I did that with the Atlantic meeting here back last winter with the snowstorm or several months ago. So I've asked for that, and that's what I'm hoping to be able to achieve, that I can attend from a distance.
And in light of now New Brunswick having its first presumptive case, will that change, I guess, your asks when you go to that in whatever way, capacity you go to that meeting, in the sense of COVID help coming from Ottawa?
Well, and certainly I had a letter back a few days ago in relation to identifying our concerns and our needs. That's from the Prime Minister's office. Basically, the announcement recently of $1 billion, I think, towards this across Canada. I wasn't surprised to see that, because every indication was there was going to be support, as with any sort of crisis that happens in the country or in individual provinces. So we will continue to accumulate information based on where our reactions are and what our needs are, both for supplies, for funding, and impact on society and the economy. And that's what we've been asked to do, and we will be doing that whether I'm president in Ottawa or not. And we'll be providing that information. What I expected was there would be a protocol set up where we'd be feeding information in on a regular basis of what our needs were. That's the message that we kind of received in the letter.
Are you, I guess, even more eager at this point to remain in New Brunswick now that we have a case, to help be part of the meetings and help organize a response here?
Yes, indeed. Certainly I feel that this is the priority. You know, we always have to set priorities for doing what's necessary, and this is absolutely the priority. I said we'll do whatever it takes, both from our government side, and working with our colleagues in the House, and throughout the province, and that includes medical professionals, which the doctor will be engaged with directly, but we want to be supportive in any way we can, because it's not about inventing a solution, it's finding a path forward to minimize any impact on citizens.
Just to go back to the school policy and nursing home policy, is it likely that the school policy, like one of those two policies, will be changed to match the other, or are they going to continue to be two standalone policies?
Well, this is kind of an evolution based on the crisis as it moves forward. And at this point, I'm reluctant to say it's a crisis in New Brunswick, because that's not what we have here, but it has been declared by the World Health Organization worldwide as a pandemic. So let's do what we can to not get there. In that sense. So at this point, I would guess that likely what will happen is we could see the other activities maybe catch up with what has happened with the schools, but I'll let that decision be made by the health authorities. It's a process we'll be going through, but what we have seen as a ramp up of this, and with our first case, which was not a surprise, no one ever expected we wouldn't see this, is that it's real. It's real, and it's coming our way. And we have to protect our citizens and really pull out all the stops to do that.
Thank you.
Merci.
All right.
Yes.
So, thank you for the lesson how to wash your hands.